Medication administration. Medication administration is going to be one of your most challenging nursing responsibilities. It can be relatively simple, but at the same time, it can be very difficult. It's estimated that medical errors are the eighth leading cause of death, with medication administration errors being the most common type of medical error. So there's several different types of medication errors. You can have omission or commission errors. Even a slight error, by your definition, can cause grave results. You are either 100% right or you're 100% wrong when it comes to medication errors. The nurse must pay full attention to the procedure. In other words, no multitasking when doing medication administration. Now, nurses are not going to know the purposes, potential side effects, medication, or normal dosages, etc., of every medication out there, but you need to be familiar with the more common medications. And when you're administering a medication, if you're not familiar with the medication, look it up. If you have any questions whatsoever as to what the medication is for, or if it's appropriate, you need to look it up. The nurse should be aware of client allergies. Know your rights of drug administration. And there is the seventh right, which is the right to refuse. As long as you observe the rights of drug administration, you will rarely, if ever, commit a medication error. Use the nursing process in medication administration. Be familiar with the client's history and medication list, and determine if the client is capable of taking the medication or if other medical concerns might cause you to question the administration of a medication or the route of a medication. In other words, maybe their pulse is too low, their blood pressure is too low, they're unresponsive, they're not able to swallow, etc. Determine if the client has special needs for taking medication, if any ordered medications might cause an allergic reaction, and determine the client's cognitive and cooperation level. There's three basic goals in medication administration planning. You need to make sure that the therapeutic effect is achieved, that there's no complications to the medication or the method of administration, and that the client and family understand what this drug is all about and how to self-administer it. With implementation, make sure that you review the order. The order has to contain the client's name, the drug that's ordered, the dosage of the drug, the route of administration, and the time and or frequency of administration. Very important. So you'll need to check the MAR. Make sure that everything is appropriate. Clarify any orders that are incomplete or unclear. And if dosages must be calculated, double check the calculations. Consult with the pharmacist if you're uncertain about whether a medication can be crushed. And just to let you know, enteric-coated tablets and capsules should not be crushed. There are a lot of automated medication dispensing systems out there that will dispense medications to you, and they automatically charge to the client. With those systems, there's no narcotic counts required except as you use a narcotic. You may have a blister pack, which is a client's medication for usually a month at a time on one card. You may have unit dose, which is one dose at a time. If a client questions a medication, investigate before you insist they take it. Review the order. Is it the correct medication or dosage? Is it actually one of the client's usual medications? If they question it, I have had patients actually prevent medication errors because they were looking at the medications and they were aware. So even if you're positive, you're sure, 100%, you have no questions, go back and look again. When you're doing liquid medications, make sure you're measuring at eye level. Oral syringes are very good for administration. Pediatric dosages should be measured in mLs. If you take a medication from a multi-dose container, make sure you label the container that the medication is in, and never turn your back on drugs. Always keep them within your eyesight. So when you get ready to give a drug to a client, you need to identify the client with at least 2 identifiers, such as the name and the birth date. You can look at their bracelet, scanning the bracelet, asking them their name, their birth date, etc. Some automated systems will scan a barcode on their bracelet and then scans medications prior to admission. Make sure that you're paying attention to medication rights. Again, if you follow the rights, you're not likely to go wrong. Be prepared to inform the client of the drug name and its purpose. So this is an extremely good reason for you to be familiar with the drugs that you're administering. Because sure as you are not familiar with it, they're going to ask you what that drug is for. Respect the client's right to refuse. If they do refuse it, document the reason why they're refusing, take action accordingly, document, and notify the physician. Stay with the client until medication has been taken. You should never leave medication at a patient's bedside until they've taken it without a physician's order. When you're doing topical medications, if you have a type of adhesive or a paper, then you always need to label the paper or the adhesive with the time, the date, and your initials. With nitroglycerin ointment, this ointment or the patch is applied to the chest, back, or upper arms, or the legs. But it is recommended that those patches come off for about a 12-hour period. Your physician's orders should reflect that. When you take those patches off, fold them in half so you don't get the residual medication on your fingers. And any residual medication that might be on the client's chest, make sure that you wipe that off with the tissue. Never apply it to an area where there is a break in the skin, or if there's a place where heat is being applied. You should wear gloves when you're applying any powders, lotions, or ointments. Make sure that areas that are to be powdered should be dry, and fully expose them. Make sure you don't get the powder in the client's face either. And always shake lotions very well. Optical. Administer optical medications in the conjunctival sac, not the cornea. Never touch the applicator to the eye. If there's more than one eye medication, you need to wait at least 3 minutes prior to administering the second one. Otic. Administer otic medications at room temperature. We try and instruct the client to lay with the affected ear for up to 2 minutes. The ear needs to be up to allow the medication to get where it needs to get to. Nasal. Occlude the opposite nair that you're injecting the medication into. Some nasal sprays are only instilled in one nair a day, and those nair are alternated. So make sure you keep track in the MAR which nair it went into. Inhalers. A spacer is going to disperse medication better, and it does not require coordination of timing when you're depressing the inhaler and inhaling at the same time. A lot of patients don't want to use these, but we try and encourage them when possible. Nebulizers. Encourage the client to take some deep breaths intermittently. There is a pipe or a mouthpiece, or sometimes a mask is used. It needs to be changed routinely because of infection control issues or washed between uses with warm soapy water. Vaginal and rectal medications. A lot of clients may desire to self-administer. It is important to use lubricant. With any suppository, you should never cut them to try and get an appropriate dose. With rectal medications, make sure that you do not place the suppository in the stool. It needs to be placed against the wall of the rectum. If it's in the stool, they're not going to get the medication. It's not going to absorb. Implementation. After you administer the medication, there are several things that you'll need to do. You need to document. What was the drug? What was the dose? How did you administer it? When did you administer it? Were there any unexpected responses following administration? Any pertinent data or assessment, and your signature and title. If the client refuses, again, document the reason for refusal in the nurse's notes. If you give a medication that is routine, usually you're not going to see any abnormal adverse reactions. But if there is something unusual that happens, then you need to document it. If you give a medication that is a PRN medication or a stat medication or a one-time medication, you always need to document the response to the medication. Document physical and behavioral responses. Nurses are responsible for evaluating everything about medication administration. Look for therapeutic and non-therapeutic outcomes and recognize clinical signs of adverse outcomes and know how to respond quickly and appropriately. For children, never ever ever overlook the importance of parents in assisting or being a good resource on the way their child takes medication. And learn from previous experiences, not only your own, but other people, other nurses. Plan on extra time and patience. Children, if you're giving an injection, will rarely become accustomed to it. With older adults, help make sure that they're not taking too many medications, and work within the client's schedule for administration times. If it's a daily medication, is it a medication that has to be taken before a meal, or can it be taken, say, 10 o'clock in the morning when the client normally takes medications? It is okay to adjust those to patients' usual dosage times as long as it's a medication that doesn't require being taken at a certain time. And with older adults, one of the most important things to consider is if there are behavior changes, always suspect the medication. When you're splitting pills or cutting pills, you never cut a pill more than one time, in other words, in half. And don't forget, liquid medications measure at eye level on a flat surface. Environmental factors, genetic, cultural factors can affect the drug itself, so make sure that it's stored appropriately. Realize that genetic differences can affect metabolism of the drug and affect how the drug affects the patient. And understand that cultural views may affect whether a drug should even be given. Drug polymorphism is a variation in response to a drug by an individual. Controlled substances are any medication that has the potential for abuse. These drugs are handled using special procedures. We have to look at federal, state, and facility guidelines. You are responsible for the narcotics that are under your care, so to speak, or under your watch during your shift. You also should be aware of the common abbreviations and the common medication schedules and the abbreviations for those schedules. Approved abbreviations are changing. There are some that have been identified as being error prone. For example, you would never use U for units. You always use, you do not use IU for international unit. You don't use QD for every day or QOD for every other day. Errors have occurred because of those abbreviations. When you have a medication error, and chances are it will happen, you have to assess the client, you have to notify the physician and the supervisor, and you need to complete a variance report. If you make an error, own up to it. It's for the client's best interest and for your best interest. We all do it. It's happened to the best of us. Routes of administration include oral, which will be buccal and sublingual. Skin would be topical, transdermal, and mucous membranes. Inhalation, parenteral, which includes subcutaneous, intramuscular, intravenous, intradermal, and epidermal.